Today's focus is on settings for community health nursing. This is Jama, Frazier, and she's one of the school nurses for Carter County School System. So a very different type of nursing, and that's probably good to hear her next. So.
This is hard to follow, very touching. Thank you. I'm just glad I didn't cry during the whole thing. That's good. I would have had a mascara down here and y'all, oh my gosh. Again, Jama Frazier. I'm one of the school nurses with Carter County Schools. This is my second year. I love it. Last year I had the little ones, the Head Start through 8th, and this year I have the big ones in high school. They're a trip, both groups. I love them both. I too started out many years ago, which I won't say. Started out as an LPN. After about 2 years in the hospital, I decided to go back to school, graduated from ETSU, the nursing program. I've worked in home health. I've worked in the emergency room, acute care. I've done some case management for an insurance company, worked with this lovely lady over here, helped to try to get the disease management program at a different insurance company going in the right direction. I was the quality improvement manager for another insurance company. After my case management experience, I wanted to go back to school, so I went to Emory University in Atlanta, graduated from the woundostomy continence program down there in 2006. I've worked as a woundostomy continence nurse in a private setting for about 5 years, and then I decided I wanted to try something a little bit different that was less stressful, or so I thought. So I go into school nursing. Wow, what an experience. The first year, I didn't know which end was up. We were so busy. The little ones out of the mouths of babes. Honest to goodness, they were great to work with. We did a lot of community health nursing as far as going out to a program called Child Fund. We actually, when we screened the children at Child Fund, we were looking for anyone who had a child that had vision problems, if they had hearing problems, speech problems, any child that would need special attention going into that school year. We found those children and got them in the right direction. Some of the things that I do on a typical day is atypical. Every day starts out different, literally. Every day starts out different. I have procedures in the school that I do as far as we do PO medication administration. We have folks that are on insulin. We have G-tube feeders that we do that. It's just not what you think of school nursing. It's not Band-Aids, sprained ankles. Now it is. I mean, that's stuff that you do, but some of these kids, we're the only point of contact for health care that they have. The folks that I have, a lot of them live in very rural areas. We have kids come in all the time that have similar, same complaints. You identify a lot of issues with these kids, psychological, social especially. They may have dysfunctional families, so you're going to be involved in a lot of different aspects of that child's life. It is wonderful to make a difference, to know that you can make a difference with these kids. We have, as far as access to health care, we have a telemedicine system now in the Carter County School Systems. Awesome, especially for these kids that don't have access to health care. We have a nurse practitioner that she can see these children via Skype. We have electronic instruments that we can actually do the physical exam and assessment to where our nurse practitioner can hear and see this child. It's anything from colds, flus, skin rashes, anything that you could possibly imagine Sharon can do, or order a further test for. The school nurses now, because of telemedicine, we can do strep screens, we can do tests for the flu, we can do urinalysis. It is just simply a wonderful tool that we have for these kids. A lot of the children, again, I mentioned, have limited access and resources. I also work with our school counselor to try to help these children get what they need. A lot of times, as Tracy will mention in her, you're next, we act as a case manager for these kids. I actually try to help them get the resources that they need, whether it be glasses from the Lions Club, Shriners. Sometimes it's as simple as toiletries, soap, shampoo, small things like that because they can't afford it, their family can't afford it. The counselor and I work together along with the teachers. They're included in their plan of care, which is actually developed any time that I identify a student with a chronic disease or a special need. We'll develop an individual health plan, which is just like basically a care plan. This is what we're going to do. We involve the physician. The families are a huge part in this. And one of the things that is really a challenge for me is when those families don't want to get involved with their kids. That's hard, very hard. You've got families that are divided. I live with mom sometimes, but dad came back into my life about 2 months ago, and he's got a new family now, but I don't know them either. So there's some issues that you've got to address. These kids are wonderful. They absolutely, it will tickle you to death and break your heart some days. It really will. The physicians have been very good to help us, to give us orders for things that we need for these children. The parents, many of the parents are very supportive, and they are involved in their care. A lot of them, the mentality of the parents and the child, it makes it hard for us to try to communicate what this child needs. They don't understand it. So we are constantly at a challenge to find better ways to help these families and these children take care of themselves. Healthy kids learn. They learn better. They stay in school. It's a matter of working with everyone together. Student, families, teachers, anyone in the community that we refer them to, whether it be mental health, it may be someone such as a case manager with an insurance company. And I have actually call the insurance company and say, hey, you know, can you help us out with this? I've had to call a doctor's office. Hey, are you accepting new patients? I have a child that the family has asked me to help find a primary care doctor for. Find a dentist, you know. You've got a toothache. I can't really afford it. Mom and dad won't take me. They can't afford it. Okay, so let's find someone that will. A lot of times, again, we go back to telemedicine. Medications are ordered. If there is something going on with them that they say they have a cold or they have bronchitis, the medication is ordered for that child at that visit, and they pick it up. We know that child got the care they need. Some of the challenges that I face is, again, the communication. Communication with the families. A lot of times you can't get a hold of them. They've got numbers that they have given us at the first of the year, but those numbers have changed and they haven't updated it. A lot of them don't have a car. Kids ride the bus, don't have a car to come pick someone up. So that's a challenge for us. Kids with special needs. I mentioned the individual health plan. We have to look at every aspect. We have some children that need to leave class early because they have to check their blood sugar, or we've got some that do intermittent cath. They need to leave and come back. So that's something that the teachers are aware of. They understand. Sports injuries. Football season comes up. Look out. Here we go. Again, wonderful kids. Hampton did great this year in basketball and football, so I'm proud of them. They did fantastic. But we do see a lot of those. As far as I have a diabetic right now that was newly diagnosed. Wonderful child. We do a lot of education. This is something that he's been seen for. He's been in the educational classes, but when he is at school independent without mom and dad, he gets apprehensive. So we're there. We teach. We give them information. We'll relay that information back to the parents, and hopefully, that will help them, that will ease their mind, it will teach them what they need to look for, portion sizes, the dose of insulin they need to take based on their carb ratio. These kids, just seeing them learn is absolutely one of the things that I love best about my job. You can watch them grow. You can watch them become more independent. Better communication with us. I mean, they'll come in and they'll say, you told me about this. This is what's going on. This is what's happening to me right now. What do I need to do? Or, you told me what was going to happen. I knew what to do, and I took care of it, but I wanted to let you know. One of the things, again, as far as a challenge that I have is with the communication and the outside resources. A lot of times we can get these children there, we can get them in, and the parents say, I don't think they need to go. Okay, that's their right, that's their option. But I try to present everything to them, one option, an alternative option, and then another. I want these children to get the care that they need. They deserve it. Seeing folks that are financially challenged is something else that we deal with. We try to get the community resources again for them. We offer a free lunch and breakfast program for Head Start through 8th now, which is awesome because some of these kids don't get that. You've got to have breakfast to start out the day, and some of them don't have that option. The counselor, again, is one of the resource people that I use, the principals, the teachers. Everything I do, I try to communicate that's related to that child and their health care to these people because everybody touches them. It's a holistic approach. You have to take it. It's just, again, not Band-Aids, ACE wraps. Everything is complicated. And it takes a lot as a challenge for me to keep up with the new treatments, the new plan of care as far as the guidelines, the standards. And I love it. I learn something new every day. I go in at 7:45, I look up, it's 12 o'clock. The next time I look up, it's 3:15, and I'm still behind. And the kids are gone, they're on the bus, and I'm like, I'm not done with everything. Paperwork, it's a part of nursing. Unfortunately, you're going to have to deal with it. The only constant is change. And again, my days are very rewarding, but they could start out with something as simple as, it's time for my medicine to, I'm not sure that I'm sexually active. Literally, I have been asked that. And it's, you know, it's difficult. You have to approach each student differently based on their age, their needs. And it's actually a wonderful profession. And I encourage you all, if you have any interest in school nursing, please pursue that. I never thought of myself as a school nurse, but I was offered the position. I decided to take it, and it's been great. Plus the hours that you mentioned. I have the summers off, and I help teach clinical with the LPN program in Elizabethton for TCAT. And I love that too. That helps me use that experience in the school setting. All of my nursing experience I've been able to combine, I feel like, to help these kids. And it's been very rewarding. So please, if you have any interest, it's not a simple job. It's not stress-free. And a lot of times it continues after school hours. So I appreciate you. Thank you for having me. And I hope you all wish you the best in your careers.